This conference will now be recorded.
Hello, please respond. Is my voice clear and audible?
Yes, sir.
Okay. Okay, right. Thank you. So we will continue in the forensic psychiatry. So we will review the previous small topics and then we will go a little more another topic. So let's begin. So we know definition of psychiatry. It deals with study, diagnosis, and treatment of mental illness. Psychiatry, it deals with the study, diagnosis, and treatment of mental illness. Forensic psychiatry is nothing but the application of the psychiatry in the administration of justice. So, forensic psychiatry is the application of knowledge of psychiatry in the administration of justice. Insanity. We have known it. What is insanity? Insanity is nothing but unsoundness of mind. And then non-compos mentis. We have learned what is compos mentis in the early chapters of forensic medicine, like medical law and ethics. What is compos mentis? We have a doctor has to certify that a person is having a clarity of mind. Compos mentis means a clarity of mind in order to give the DD, the dying declaration or dying deposition. You must have this clarity of mind. Compos mentis should be there. So the doctor has to certify that he's oriented in the time, space, and person is good. In insanity, it is non-compos mentis. So there is no clarity of mind. So when a person suffers from some disease of mind, as a result of which his mental faculties, functions, or emotions manifest abnormal, then he is said to be an insane person. So all his mental faculties, functions, and emotions, they are abnormal because of some disease he is suffering. So because of that, we call it as insane. So we have known what are the abnormal manifestations of psychiatric illness: delusions, hallucinations, illusion, impulse, obsession, phobia, and delirium. Having up to phobia we have discussed, and today we will discuss about delirium. So delusion is a false belief contrary to the fact that it persists even after its falsity has been proved, and it will have force of conviction. So delusion means false belief where after even his falsity has been proved, the person will not believe that it is true. So we know we have different types of delusions. Delusions of grandeur, exaltation, where a person, even though he is a beggar, he believes that he is a king of the world and he is a very rich man. That is known as delusions of grandeur, exaltation. Delusions of persecution. The person believes that there are a group of people who are planning to kill him and poison him. So he reacts with suspicion to every word of his nearby people. So delusions of persecution. That is a false belief where he believes that people around him are planning to kill him and poison him. Delusions of infidelity. The person believes that his wife is not faithful to him, even though she is of good character and conduct. He has a false belief of infidelity. Nihilistic. A person imagines or believes that his body is no more and everything is ending. Nihilistic. So he imagines that his body is no more and everything is ending. Jealousy. Person believes that everyone is jealous of his achievements even though he has not done anything. So jealousy is, he feels that everyone is jealous of his achievements, but in fact he has not done anything for that. Self-reproach. A person feels that he has done many sins, due to that his career ends. In fact, he has a good conduct and bright achievements in past. So delusions of self-reproach. Delusions of influence. A person believes that every action and thought of him is controlled by outside agencies like newspapers or radio or hypnotism. So it is known as delusions of influence. So the person believes that his actions and thoughts are controlled by the TVs and then the news and then the radios and the newspapers. Hypochondriac. So the person believes that something is wrong with his body and cannot be corrected through it, though he is healthy. Hypochondriac delusions. A person believes that something is wrong with the body and it cannot be corrected. Hypochondriac. Religion. Delusions of religion is a person believes that he is a representative of God and all actions performed are the directions of the God. Reference. Delusions of reference. A person believes that even strangers are looking and talking about him, so they refer to that person in a special way. So reference is where he believes that if two people are talking, he believes that these two people are talking about himself only. So what is the medical legal importance of delusions? Delusion is never an isolated disorder. It is always associated with some disorder inside or in some mental disorder. So for this reason, such a person cannot be regarded as fully responsible for his antisocial behavior. So anybody is suffering from delusion and then he is involved in any antisocial behavior, whatever it is, any crime, whether murder or theft or whatever. So the court assumes that he is not responsible for him because he doesn't know the implications of his actions. Next, hallucinations. Hallucination, otherwise it is known as wandering of mind. So we know delusion is false belief, hallucination is false perception, false sense of perception, without any external object or stimulus to produce it. So the hallucination is false sense of perception without any external object or stimulus to produce it. So they are purely imaginary and may affect any special senses. So types, we have auditory hallucinations where the person hears voices even when there is an absolute silence, and these voices can be pleasant, sometimes they can be violent type. So auditory hallucination. Visual hallucination, the person imagines a ghost or a beast when nothing is present. Olfactory hallucinations, where a person will smell some unpleasant smell when there is none is present. And then gustatory, the person can feel a taste of food even though there is no food in the mouth. So auditory, visual, olfactory, gustatory, and then tactile. The person feels that some insects or ants are crawling over his body. In fact, there is nothing like that. So this tactile oscillations, we all know delirium tremors. It is also known as cocaine bug. Cocaine bug, where we've seen in chronic drug abuse with cocaine, the persons will feel that some ants are crawling under the skin, as in a sand-like feeling under the skin. And also you can also see in alcoholics. In alcoholics, they have delirium tremors. So all these are the hallucinations, which are tactile hallucinations. And then psychomotor. The person feels that some part of his body is moving, even though no such thing has happened. So psychomotor. And then sexual hallucinations, persons feels that penis is erected and orgasm has occurred even though nothing has happened. Next one is illusion. Illusion is false interpretation. So delusion is false belief, hallucination is false perception, illusion is false interpretation. So it is a false interpretation by the senses through external stimulus. So in case of hallucination, there is no external stimulus. External stimulus is absent. Whereas in case of illusion, external stimulus is present, but he will falsely interpret that external stimulus. So the external object or stimulus exists, but senses falsely interprets. Example, a rope hanging on a tree is falsely perceived as a snake. The stem of a tree, the patient thinks it is a ghost standing there. And then a person comes with a dog to meet him, but he thinks that he has brought a lion to kill him. So Here the dog is there, so he interprets it as a lion. So stimulus is there. The stem is there, the tree is there, he thinks that it is a ghost. The rope is there, he thinks that is a snake. So stimulus is there, but he will falsely interpret it. Whereas in case of hallucination, there is no stimulus at all, but he will imagine things that something is hearing and something is crawling. Next, impulse. What is impulse? Impulse is sudden, irresistible force compelling a person to the conscious performance of some action without knowing or forethought. It is a sudden, irresistible force compelling a person to performance of some conscious action without knowing or forethought. So he will suddenly prone to do some actions without his conscious, without any knowledge. So a sane person is capable of controlling an impulse, but an insane person has no judgment, no reasoning, and no capacity to understand the facts. So he does it. Examples: this impulse is seen in acute mania and dementia. What are the examples of this impulse? Kleptomania, which is irresistible desire to steal articles of little value. Kleptomania, it is irresistible desire to steal articles of little value like pens, rubbers, even some little articles, whatever. So which has no value or very little value. So kleptomania, desire to steal articles of little value. Pyromania, irresistible desire to set fire to things. Pyromania. Mutilomania, irresistible desire to mutilate animals. Dipsomania, irresistible desire for alcoholic drinks at periodic intervals. Dipsomania. Suicidal and homicidal impulses. Irresistible desire to commit suicide or homicide. Trichotillomania. Irresistible desire to pull out body hair. Trichotillomania. So these are some of the impulses, and then we come to the obsession. What is obsession? In this, a single idea or a thought or an emotion, a single idea or a thought or emotion, it is constantly entertained by a person, but the idea is irrational. So it persists in spite of all the effects to drive it from his mind. So it is an idea or a thought or emotion which is constantly, the person is thinking about it, but he knows that the thought is a useless thought. It is an irrational thought, but still, in spite of his efforts to drive it out from his mind, he is not able to do it. Again, the thought will come out. This is known as obsession. It is a disorder of thought content, and any attempt by individual to resist makes them appear more resistible. This is the borderline between sanity and insanity, and they are able to discharge ordinary responsibility, and they are associated with fear and dread. What is phobias? It is an excessive and irrational fear of a situation or an object. Phobias. It is, I think, phobias, everybody has a phobia. So excessive or irrational fear of situation or object. Some of the types of phobias are acrophobia, which is fear of heights. Agoraphobia, which is fear of large open spaces. Agoraphobia. And then aviophobia, it is a fear of flying. Claustrophobia, fear of closed spaces. So agoraphobia, fear of large open spaces. Claustrophobia, fear of closed spaces. Hemophobia, fear of blood. Mesophobia, fear of germs and contamination or dirt. Nasophobia, fear of contracting a disease. So now everybody has this fear in this COVID-19 situation, pandemic. So nasophobia. So we cannot be panic. We should take care of ourselves and follow the rules. So nasophobia, fear of contracting a disease. It is good to have some degree of caution. It is good to have prevention. As we know, prevention is always better than cure. But unnecessarily panicking, unnecessarily having this phobia is not going to help you in any way. So nasophobia, fear of contracting a disease. Xenophobia is a fear of strangers, foreigners, or aliens. So up to this slide we have finished in the previous class. So now we will look into this lucid interval. Lucid interval, I think we have looked into previously in mechanical injuries. So in forensic medicine, there are two lucid intervals. One is in mechanical injuries, and particularly in regional injuries, and particularly in head injuries. And another lucid interval can be seen in forensic psychiatry. So we will see what is the difference between that lucid interval and this lucid interval. So lucid interval here is, this is a period occurring in insanity during which all the symptoms of insanity disappear completely. We can say it is a period of sanity between two periods of insanity. So lucid interval, according to the forensic psychiatry, is it is a period of sanity where the person is completely conscious, completely normal between two periods of insanity. So either on the other side of the either sanity, the person is not having a normal mentality, is suffering from some symptomatology of the mental illness, but during the period of lucid interval, the person is completely normal. So by definition, it is a period of sanity between two periods of insanity. In this period, the individual can judge his acts soundly. He becomes liable legally for his acts because he is completely normal. His mental condition is okay, and then he knows what his actions can produce, and he knows what are the implications of his actions. So he is completely liable for his actions if the person does any crime during lucid interval time. So if he commits an offense, he cannot be completely held responsible because it is difficult to know whether he is suffering from mental abnormality at the time of committing that offense. So it is the duty of the doctor to find out whether he is in the lucid interval time or it is in the other say insanity time. So a doctor has to differentiate so that he can have the benefit of doubt in the court of law. So lucid interval is seen in mania, in melancholy, and then you can see in EDH, extradural hemorrhage. So lucid interval, we know it is derived from Latin word lucidus, which means clear, clarity of mind. Lucid interval is a period of clarity of thought between two subsequent bouts of mental illness. So it is a period of clarity of thought between two subsequent periods of mental illness, and it is most commonly seen in bipolar disorders. Bipolar disorders where we have a maniac episode and then we have a depressive episode. At one point of time, the person will be very excited, very active, very violent. Another point of time, the person is very depressive, sitting at a corner and then not talking. So this is known as a bipolar disorder, where two poles will be there. The person will be excited at one point of time, and then another point of time he will be very depressed. So between these 2 points, we can see the lucid interval. So bipolar disorders, most commonly lucid interval can be seen, and then it can be seen in head injuries where we have known by definition lucid interval. In regional injuries, we know that it is a period of consciousness between two periods of unconsciousness. It is a period of consciousness between two periods of unconsciousness when it is related to the mechanical injuries, and when it related to the lucid interval, it is a period of clarity of thought. It is a period of sanity between two periods of insanity. So here you can see this is just a diagrammatic representation from A to B, and then you can see B to C and then C to D. From A to B, B it is insanity, and then from C to D it is a period of insanity, and then B to C is the period of sanity. This B to C is known as the lucid interval time. So the person will be excited in the either case, and then in B to C he will be depressed phase, and then he has the clarity of mind during this phase, whereas on the other side of the phase he will be very excited and he doesn't know the implications of his thoughts and actions. So medical legal importance is the person is responsible for all the civil and criminal acts done during this lucid interval, definitely, because he knows what he is doing. His mental condition is clear during lucid interval. He knows the implications of his actions. So he is fully responsible for his actions, and he can be prosecuted for his criminal acts. So for example, he can make a will during the lucid interval. He can enter into a contract. He can enter into a business. Even though, suppose if you're committing a murder, he's still a responsible thing. So he has to take the punishment for that. So what is the difference between lucid interval of the head injury and the lucid interval of the insanity in the forensic psychiatry? So in head injury, you can see there is always history of head injury will be there. Whereas in case of how to differentiate the lucid interval between the head injury caused due to head injury and caused due to mental illness. So in head injury, there is always a history of injury. Whereas in case of insanity, there is a history of mental diseases. And then in head injury, the lucid interval is preceded by a phase of concussion. We have seen in case of head injury, the person, by definition, it is a period of consciousness between two periods of unconsciousness. If you see, for example, EDH, external hemorrhage, where the person, when he hits either accident, he will have a violent shaking of the head. So there is an injury, there is concussion of the brain, thereby he loses his consciousness, he becomes unconscious, and then we know concussion is reversible, no treatment is necessary, so he becomes again conscious after 24 hours, and then because the EDH is arterial bleed, it slowly builds up in the brain, and then a point will come where it will push the side of the brain to the opposite side, thereby causing some pressure effects on the midbrain. So again the person will go into unconsciousness. So there is unconsciousness immediately at the point of accident, and then he becomes conscious after recovery from concussion, and then again he will go into unconsciousness because of the pressure effects of the hematoma on the brain. So there is a phase of concussion in case of head injury, whereas in case of insanity, there is a phase of symptomatology of insanity or mental diseases, and then lucid interval followed by a phase of cerebral compression, and then lucid interval is a recurrence of symptoms of insanity, and the number of episodes is only one time, only once we can see in head injury, whereas the lucid intervals can be seen multiple times. The recurrence of lucid intervals can be seen in case of insanity. What is delirium? So delirium is a state of disturbed consciousness, orientation which is impaired, and critical faculties which are blunted, and thought contents which are irrelevant. So it is a disturbed consciousness, impaired orientation, blunted critical faculties, and then irrelevant thought contents. So maybe due to mental stress. So why delirium will occur means even a high grade fever can cause delirium. A drug toxicity can cause delirium. Delirium is most commonly seen in hospitals. So an elderly patient, you can see he was in ICU, he was tied to a bed. So why they are tying to a bed means because he is delirious. He is violent, he is delirious, he doesn't know what he is doing, he will break everything, he will pluck it out, the IV lines and everything. He can pluck the nasogastric tube, everything he can do, whatever it is, Ryle's tube, he can pluck it out. So in order to prevent such a person, then we have to restrain the person. So because his consciousness was disturbed, His orientation was impaired, and then critical faculties are blunted and thought contents are irrelevant. So delirium is derived from the Latin word delira, which is out of the furrow or off the track, which means off the track. He is not in line with the normal things. He is off the track, and then he is a common and severe neuropsychiatric syndrome with the following features. It is acute onset. It has a fluctuating course. These four points are very important. Deliriums are always acute in onset. They have fluctuating course. There is attentional deficits, and then there is reduced clarity of awareness of the environment. Reduced clarity of awareness of the environment. There is acute onset, fluctuating course, attentional deficits, and reduced clarity of awareness of the surrounding environment. So what are the silent features? It is the commonest organic mental disorder seen in clinical practice. About 5 to 15% of all medical and surgical inpatients develop this delirium. So what are the causes of this delirium? So it can be medical conditions, especially when there is a continuous rise of temperature. Example is sinus infections. It can be head trauma, can cause delirium. Toxic substances like datura. Datura will cause deliriums. So we have 10 Ds for datura. So there can be in datura poisoning, there can be midriasis, there can be dilatation of the pupil will be there will be dryness of the mouth. So there are 10 Ds like that, and then one D is delirium. So these are some of the causes. So medical conditions where there is increased temperature, especially CNS, head trauma, and then toxic substances. So what are the features of delirium? There is clouding of consciousness of the surrounding environment, and there is a decreased awareness of the surrounding. Thereby, there is a decreased ability to respond to the environmental stimuli. Disorientation. So most commonly in time, then in space, and then later in person. In disorientation, mostly if you ask the person who is there in home, who is disoriented, he will say that he is in hospital. So first time disorientation to time is lost, and then if you ask him where he is, he will say somewhere. If he is in home, he will say I'm in hospital. If he is in hospital, he will say I'm in home. So disorientation to the space is lost after time, and then later person, he cannot recognize his son, his daughter, or whatever. So the person, he cannot name the person where. So first disorientation to the time, then to the place, then to the person. So there is, and then there is decreased attention span and distractibility is there. There can be illusions, hallucinations, and most common hallucination is visual hallucination. And then we have recent memory is lost here. Recent memory is lost and remote memory is normal. Sleep wake cycle is disturbed, so he will have more sleep in the daytime, and then he will not insomnia at night time will be there. And then sundowning phenomena is there, where the symptoms will be more marked during evening times. So there is a worsening of symptoms in evening, so that is known as sundowning phenomena. And then psychomotor disturbances, where the person can have hyperactivity, agitation, like that. What is the medico-legal importance? A person become impulsive and violent and may commit homicide or suicide. A person in delirium is not responsible for his acts. The wills made in delirium are not. So the wills made in the delirium are not valid. He is not responsible for his actions, and then becomes very violent and impulsive, and he can have homicidal, suicidal tendency. So how to diagnose this insanity is we have to observe the person for a period of 10 days. So keep in psychiatric ward, observe the person for a period of 10 days, and then if you want to extend the time, you have to or another 10 days from an example of 1 month. And then a person with violent behavior is kept in a prison, and then person should be watched when he is alone and when he is working and reading and writing and everything. So examination, we will quickly go through it. So anyway, you will learn in psychiatry. So we will have a brief thing. So we have to take the preliminaries like name, age, sex, and then the timings, uh, family history, whether any person in the family is suffering from this kind of mental illness, personal history, whether there is any history of any previous mental illness is there in this person, and then what are the environmental factors, any anxiety states are there, any emotional aspects are there in his life, any whether he is suffering from any diseases, organic diseases like CVA, cerebrovascular accidents. CVA or strokes are the most commonly we can see the deliriums in the hospitals, and then head injuries and toxemia, any poisoning, and then any drug dependencies is there or not, uh, and then any domestic difficulties in the home, any discordance between wife and children or wife and husband or anything like that, emotional shocks like any loss of lives in the family in the recent area, frustration, the love and life. So and then any financial worries. So all these things can affect his mentality and it can lead to this thing. Physical examination, you have to observe the patient, the manner of dressing, walking style, gestures, any deformities are present or malformations of the head, and you have to know the vital signs. So we have to assess the mental condition by general appearance, how is dressing, what is our habits, and then facial expressions, mask faces are there or not, and thought, whether there is he's talking, mutism is there, aphonia, any distractions, or he is talking irrelevant talking, echolalia. Echolalia means he will repeat same things. Repeating same irrelevant is known as echolalia. And then preservation of talking, wandering of speech. He will speak one aspect or one area at this, and then immediately he will change the topic there in some other. He will speaking about some other topic. And speech, whether it is coherent or incoherent, aphasia, if he is speaking or not, whether it's slurring is there, agraphia, whether he is able to write what he is speaking, or there is a flight of ideas, and then insulting language is using or not, behavior, whether it is any stereotype or mannerism is there, and then whether it is lethargic. Ecopraxia is also when I suppose if the other person repeats any action, he will have the same action. So it is a repetition of same words and repetition of some actions. Suppose if somebody, the person who is before him is scratching his head, he will continually scratch his head without any meaning. So it is known as ecopraxia. So how his moods are there, whether he is about angry, dull, depressed, or apathic, irritable, and memory, you have to check memory, concentration, appreciation is there or not, and sleep, whether is able to, insomnia is there, hypersomnia is there, somnambulance, where sleepwalking is there or not, gait, whether it is hurried walk or normal gait, attitude and posture, whether it is peculiar attitude or aggressive, worried, how is the sexual behavior, attentive or fluctuating attention is there. So all these things you have to see, and then investigations we will do routine blood, urine, CSF analysis, and then EEG. EEG is very important, and then we'll go for the so finally we will look into this table and we will close. The difference between true insanity and feigned insanity. So why it is important means, feigned means false insanity, true insanity. Suppose if the person has committed a crime, so if you want to get out of the jail, he will act as if he is a mentally ill person, so that the court can say that he is a mentally ill person, and then he is not responsible for his crime, and then he can be left alone for his crime. So for that, the person can feel insanity. So how to differentiate with this one? So onset, in true insanity, it is a gradual onset, whereas in feigned insanity, it is sudden in onset. In true insanity, motivation is absent. There is no motivation. There is no history of any crime in case of true insanity. Whereas in feigned insanity, the motivation is present. He has committed some crime and wants to take the benefit of Section 84. Section 84 stands for McNaughton's law. Now we will discuss it, where a person is exempted from any crime because he doesn't know the implications of his actions because of his mental illness. Predisposing factors that are usually present in true insanity. There is history of insanity in parents may be present. A sudden grief, loss of dear ones, and monetary loss, financial loss can be there in true insanity, whereas in feigned insanity it is absent. Signs and symptoms. In true insanity, signs and symptoms are uniform and present whether the patient is being observed or not. This is very, very important. So the person is, whether it is observed or he is observed or not, the symptoms are present. Whereas in feigned insanity, they are present only when he knows that he has been observed. The symptoms are variable and haphazard and do not fit into any definable illness and may be excessively exaggerated in feigned. So this is very important. Suppose if you observe the patient in a closed room, in true insanity, they are present always. Whereas in feigned insanity, they are present only when he knows that you are observing him. Otherwise, they are absent. Facial expression, their peculiar and vacant look is there. In feigned insanity, there is no peculiarity. Insomnia is present in case of true insanity, and the person may not sleep for several days. Whereas the person in feigned insanity, even if you make him not to sleep for 1 or 2 days, on the 3rd day he will sleep. So exertion, a person can stand exertion, fatigue and hunger for a long time. The person cannot stand exertion for more than a few days, breaks down after that. Habits, the dirty and filthy habits in case of true insanity, whereas in feigned insanity, they are not, the habits are very good habits. Skin and lips are very dry and harsh in case of true insanity. They are normal in case of feigned insanity. Reaction to frequent examination, in true insanity, the person doesn't mind as he has nothing to conceal. Whereas in case of feigned insanity, he resents repeated examination as he fears detection of malingering. So we will close here and then we'll continue in the next class. Thank you for joining. Have a good day. If you have any doubts, you can ask me. Otherwise, we'll leave.